Hi there, and welcome to the Fact of Lounge podcast. I'm Dr. Sarah Gander, your host for the podcast, your faculty development podcast through Dalhousie Medicine, New Brunswick. You may notice a little bit of a jazz singer tone in my voice today as I'm home with our guests who are virtual to me today, as I'm home with my first infection of COVID-19, and so experiencing that, but feeling on the other side of it. So I'm so excited to have finally been able to sit down with Matthew MacLennan and Mitch McDonough, who are students at Dalhousie Medicine, New Brunswick. And our topic today is why it is incredibly awesome to accept elective students into your practice and into your day. And so we're going to chat a little bit about elective experiences with the students and some of the challenges over the last couple of years. And hopefully I'll keep my coughing to a dull roar. So welcome, Matt and Mitch.
Thanks so much for having us, Dr. Gander.
Yeah, no, this is great. So maybe what I'll ask you guys to do is just to introduce yourselves and give a little bit of a background about maybe where you're from and what year you're in, and then we'll get to talking a bit about electives. So Matt, why don't you go first?
Yeah, sure. So, and first, thanks for having me here. So I'm Matthew. I'm a second-year student at the Dalhousie Medicine New Brunswick campus, and I'm originally just from outside of St. John in French Village area, and went to the University of New Brunswick Fredericton for an engineering degree. So I got into medicine shortly after, and been loving it ever since.
Awesome. We're happy to have you. You're not just from outside St. John. You can say it's like, I'm just from outside St. John. You're like from outside St. John. Awesome. Mitch, how about you?
Yeah, so my name's Mitch. I'm a fourth year Dalhousie Medicine New Brunswick student, also from just outside of St. John, New Brunswick. Matt and I actually were neighbors for a long time growing up.
Oh, that's fun. So do you have any like weird secret stories that you like hold over his head, like the time you caught him sneaking out or anything like that?
No, nothing like that. He was a goody two-shoes.
Very good. So you guys, we got together on this call for this podcast because we had a meeting earlier in the week that really was about how there are some challenges about elective students. And not the elective students themselves, of course, but rather matching elective experiences with students. And the process has changed over the years. And I think what I bring to it as being a clinician that gets asked for electives now and then is that sometimes it is sort of like, oh, do you have sort of the capacity for that based on like what level of learner it is? And do you have room in your clinic and COVID and all the things? And so I think it would be great to sort of talk about what your experiences have been, where you see some of those challenges and successes, because I've certainly had wonderful experiences with elective students. But yet it does seem to be an ask of people. So maybe Mitch, we'll go to you first this time. Like you're in fourth year, your electives are largely behind you. Overall, how did it go for you?
Yeah, so for me, my elective experience was excellent overall throughout my medical education. I was fortunate in the fact that my pre-clerkship electives happened prior to the COVID-19 pandemic. So for me, finding electives weren't as challenging as it may have been for some of the first and second year students over the past few years. Really, the elective experiences are really what students look forward to for the most part as part of their pre-clerkship, as it's the only time they really get an opportunity to practice clinical medicine and see how it's done on a first-hand basis, as opposed to hearing about it from attending physicians who are teaching you. And I think a lot of the times it's what students look forward to for the most part each and every week. And I know for me, it was something that I really enjoyed. Additionally, the electives give students an opportunity to experience different specialties that they may not have really had a ton of exposure to prior to medicine or really heard anything about prior to medicine. So for me, I came into medical school not really knowing what I wanted to do for a medical career. And it was speaking to the upper year students at the time who provided me some insight in terms of what electives are great opportunities to figure out a career choice and really practice those clinical skills and really become an excellent clinician at the end of the day. So I was really fortunate to have excellent mentors in the upper years who led me to do an elective in ENT in first year. And then in second year, I did an elective in plastic surgery as well as radiation oncology. And they were all really excellent experiences because I was guided by those students prior to me telling me what to expect and who I should work with that really matches well with my personality. And as a result, they've been really excellent learning opportunities. In terms of the fourth year elective experience, that changed quite a bit the past year to 2 years because of COVID-19. The portal was no longer in effect, given that students were only doing home electives. And that really created a challenging situation for us as fourth year students, as well as the year prior to us, because you weren't able to experience other schools and really get an idea as to where you may want to practice and do your residency for the next 2 to 5 years. However, I think Dalhousie did an excellent job in transitioning to homeschool only electives and really made it a seamless transition. But I think that's probably created a lot of additional burden on the attending physicians as well, given that people aren't leaving to do electives and everybody's staying in their home schools. So there's a lot more students around, and that may have caused a bit of challenges for some of the younger year students to find electives. But really, I think overall, the experience for electives for students is a really great one and something that we appreciate very much, and that at the end of the day, I think it's a great learning opportunity for both the students as well as the attending physicians to.
Yeah. Well, awesome. I mean, there's a lot you covered there, Mitch, because there's elective experiences in so many different years. And so maybe just for people listening, in case they haven't had an experience before, I mean, we get asked as staff to take people on day one of medicine, right? For like an observership, or sort of like your very first day of medical school. And then there are Med 1 and Med 2 experiences, which are like a half day a week. And then there's the proper sort of electives preparing you for sort of your CARMS things. So there's all these opportunities. And you're right, you're kind of trying to figure out, do you have the capacity to take them? And then particularly in the past year, where we were seeing students who we had worked with before, because they were our clerks maybe, coming back for electives. And then the challenge to us is, okay, well, how much more do I have to offer? I've already worked with you for 4 to 6 weeks, and now you're back for 2 weeks. And so really calling on attendings and faculty to step up and sort of create a different experience with that elective experience outside of kind of the core clerkship blocks that we're used to, at least in St. John. LIC is a little bit different. So maybe they felt differently because they could then hone 2 weeks down with somebody, which would be really nice. So there's a lot to go back to there too, but I just thought maybe to transition to Matt's experience, do either of you remember that very first day elective experience, like that day one shadowing? And I promised you wouldn't have to name any names. Mitch, you gave a little list of people that maybe paid you to say that. I don't know, but your positive experiences. But your day one experience, what was that like? Like, did you just show up and they're like, you're with, I don't know, so-and-so today?
Yeah. So for me, I was I started in 2020. So, COVID was kind of in full swing at the time. And really, we kind of got an email notification saying like, okay, you're going with a doctor for a day and you get to interview and here's your preset of questions. And unfortunately, like it was virtual. So it was done, like you had to organize your own like Microsoft Teams thing. So I was kind of hoping to get through like the anxiety of like walking through the hospital, not as a patient, but as like as like something different, I guess, for the first time. But in short, though, like when you're walking into medicine, especially for someone, I came from a non-traditional background and didn't have a lot of exposure to the healthcare system. So even getting into like an isolated setting where you have a physician's undivided attention, and really he gave me as long as I needed, really, and booked off like as much time. And so it was just like a welcoming thing where it was like, okay, I could ask the silly, maybe slightly like less prestigious questions, I'll say, but more just to like come as like, it's like I'm a brand new student. I'm going to ask a lot of simple questions, but it was a great way to like get those out of the way and kind of like I asked larger questions like, okay, well, what does a physician do during the day, and how does that fit into the cog of like a healthcare system in delivering care, And it was just like, it was super insightful regardless of like maybe the setting it took place, but it went really well.
Yeah, it really sort of breaks the ice for you, because then things are going to happen next, but at least you kind of got your foot in the door, or virtually, I guess, to sort of feel part of something. I think on our end, as faculty, we really like those days because, first of all, it's a flashback for us because it brings us back. Anytime you spend time with students, it's fun because if you give yourself any moment of contemplation, you get to have like that walk down memory lane for a minute. But so like right now it's CARMS, because anybody I'm helping with CARMS, it's slightly triggering. That's more traumatic. But the early days of medical school were really sort of fun and fascinating and interesting. And so that's so good to hear that it's a positive experience and that person took the time that day to really hold that space for you and welcome you and make you feel welcome, because that is really important in that kind of sense of belonging and that you are in the right place. Mitch, do you remember your first day?
I do. So my first day, I was with a family physician who did obstetrical care as well. So I spent my first day and my first morning at St. Joseph's Hospital doing prenatal assessments on pregnant women.
Oh my goodness.
Yeah, so that really threw me into the deep end the first day. Really fun experience though. I think they used to call that first day of medical school stock-a-doc. I don't think they do anymore, but...
I haven't heard that before.
No, I think they call it just shadow physician now, but certainly an interesting experience overall and something that I think would be really funny to look back on and even to interact with that attending again and see how much progression that we've made as students over those 4 years, because I remember thinking to myself, how am I ever going to do this? This is so overwhelming. But now, after the 4 years of medical school, it would just be another day and could really handle it so much better. But it really is a really interesting experience. And I think for attending physicians as well, just being able to see the progression and the development of the students, particularly for us this year, given that we did fourth year electives in St. John as well. Mm-hmm. So for example, you, Dr. Gander, I worked with you on several occasions during clerkship as well, but didn't have the opportunity to do any fourth year electives, but I'm sure several of my classmates did. And being able to see that progression and development is something that's really interesting for attendings as well.
No, that's definitely true. We didn't lure you over to the light side of pediatrics. Can stay on your dark side of surgical specialties and things of that nature. No, I'm just joking. We all play a role, don't we? It does not matter. So you guys, then we get into sort of those first and second year electives. And I think that that's a really interesting time because that's sort of because I think anybody listening appreciates that there's a lot of pressure to sort of decide some of this, path that you're going to take early. Now, people from the university will cringe because they'll be like, Sarah, don't propagate those rumors because we want to believe that you're pluripotent and you're, right up until the end sort of thing. But the realities are that there are pressures, and there's pressures to do research, and there's pressures to get to know people and stuff. And so how would you guys kind of describe that first and second year experience and the challenges there?
I can at least maybe speak on the COVID area. Mitch was kind of around pre-COVID era. So, and coming to the end of my second year, I'm kind of fresh out of this kind of component of my education. But I remember my first few days at DMMB virtually, I guess. But you're told right at the gate, Dal prides itself in saying on your first day you get to interact with a doctor and shadow them or stalk them, whatever vocabulary you wish to use, and then within 2 or 3 weeks, give or take, you're asked to, okay, well, what do you want to do your first elective in, and that kind of stuff. In your first year, you're asked to do one elective, and then you're given a mandatory placement of 6 weeks in family medicine. So for a lot of students, for half this class, basically, you kind of get to defer your elective selection until the winter term. But for the other half who have to decide right away, that can be a frightful experience. When students get through the medical kind of application admission process into medical school, you kind of go, I made it. And within a few hours, you start hearing this uttering of CARMs and matching and things. And you kind of go like, what? Like, it's not over, So, and so I was fortunate to have time to pick until winter, but I remember like talking with classmates and stuff, and the pressure's there because, there's a graph that I know that's out there, but early on in like project management and decision makings, when you had the least amount of information, you have to make the biggest decisions normally at the start.
Oh.
And it feels like that in medicine where, okay, I have to pick an elective that is going to really like show me what medicine is, but I actually don't know very much. Like most students don't know the intricacies in all of the different specialties, So Mitch kind of like hit it right on the head. Like you kind of got to reach up to upper years, and particularly those that might know you. So Mitch being a neighbor of mine for years, like I went straight to him and was like, you know me, like, my good, my bad, my quirks and all that stuff. Like, this is kind of where I'm at. And what, who do you recommend and what? So it's actually, there's a trusting game too, where you have to kind of defer that. And, you're reading books, you're watching Netflix shows, like you're trying to figure out like what specialty maybe you want to check out, but it's nerve wracking. But as you grow, like, there's not a lot of pressure to be perfect right from the gate. And any experience in medicine, I've been told this and I believe it's true, like any experience helps your differential in finding what you love and what you don't love. And regardless, you're going to see a lot of things inside your scope of practice and outside. And so any of the experiences, like, hopefully, you're able to plant some solid like memories and kind of like be able to recall things. So, but it's also interesting to see it develop over the years. Like now as a second year student, like, I'm no expert by any means, but as compared to my first elective to now I'm on my third, like you start to know the ins and outs, the ropes, and you start to find ways to be more and more useful and productive in terms of like, the staff as well as the physician's scope of practice. And so that's also been enlightening to see. And you kind of, as you learn more clinical information in your classes, you're able to apply that outside. So it's a nice kind of like segue as you move along with things. But the beginning can kind of seem like Mount Everest. It's only as you start to climb it, you're kind of like, it's not as bad as it looked like at the start.
Okay, side tangent story. My husband and I went to the base camp of Everest, and he's a good sport because he'll do things that I want to do, and I love to climb and hike. So we go to Nepal. This is before we had kids. We get to the base camp of Everest. We both have a splitting headache because of the altitude. We get to the base camp, and he turns around, and the guide says, and in the morning, we'll climb this mountain so we can actually see Everest. And Steve looked at me and said, you're telling me that you can't see the mountain from base camp? And he like had his only temper tantrum of the whole trip of hiking for like 10 days. It's like, you're kidding me. You can't even see the mountain. I was like, oh, sorry, babe. So there you go. Matt, you touched on two really important points. One is that I think faculty and like the organizers at DMNB in their hearts want so badly for those early electives to be so much more than just, am I going to dip my toe in like ENT, for example, and should I be reading up all about ENT, and maybe I want to do ENT, and so much more about, like you said perfectly, like getting used to things and getting exposed to things. And, I'm a pediatrician, but I very much am interested in knowing all those little pieces of medicine still that just kind of make you kind of I don't know, the word isn't more complete doctor, but I was kind of sad it'd be embarrassing to not be able to like deliver a baby in a taxi cab or like give somebody an aspirin in a plane if they were having chest pain. You know what I mean? Like you kind of want to know some of these things, even if it's not going to be what you do for the rest of your life. And the second thing that came to me was just how faculty can really look at that elective too differently and say like, okay, you haven't done this before. There's nothing more gratifying than feeling a bit useful in your upcoming elective. So I'm going to show you what a chart looks like and how you document in a chart and how you look things up and like all of those practical things that are really kind of not quite hidden curriculum, but just like the logistics and basics of it that I think are so helpful regardless of what the specialty is. And not feeling like, oh God, you don't know all the arteries in the neck. So what good are you to me today in the vascular OR or whatever, which then kind of makes you feel like you're not that useful or that you're not really valued to be there. So I think those are some wonderful points, both for students to take away how important even in elective experiences, like say you do an elective in ENT, I don't know why we're picking on the ENTs today, the ENT, and then you decide to do peds. I mean, how much ENT is in peds? Loads. But also just if somebody else writes you a reference that you aren't even applying to their specialty and they can write you a glowing reference. So you showed up there with like all of your 100%, even though it wasn't the specialty you wanted. I think that says loads too. So I think there's amazing opportunities in both, like whatever happens there. My pitch was that we just plopped you guys wherever, so you didn't have to do that. But like, I think pretty much somebody would slash my tires maybe. So, well, and Matt, overall, you had pretty decent experience trying to get your electives and things, or, let's talk a little bit about this sort of grasping for, finding the people who have spots and that kind of rat race piece, which isn't supposed to be there, but it sounds like it's kind of happening.
For students, like we're given a spreadsheet with a bunch of names and a bunch of emails, and it's really like first come, first serve, and each individual physician gets to set, the where, the when, and what works to meet like the different objectives or deliveries that need to be done for an elective. But they also just determine like how many students they bring on. And that's definitely changed as, electives have kind of been taken away and that kind of thing. So my personal experience, like my first one, I got my elective through my RIM mentor. And so I asked him, it was kind of like, great, we're doing a project. Now, how about an elective? And then like that transitioned smoothly. Like you got to be a little bit of a car salesman, I guess, to kind of get through. And the other ones, it was really just networking with senior students and trying to get in some ideas. And after your first year of medicine, you've kind of at least heard the name of most things, and you start to kind of go down rabbit trails, Googling things, and you go, okay, that might be cool to check out. So, and really the ratio of students to like this spreadsheet like normally works out well. There are particular electives, especially like emergency medicine, where it's a straight up lottery. The demand is so high, and it's even limited to only second year students. Often if you're in first year, like, you're not even privy to put your name in the ballot. And so you kind of have to maybe play the waiting game a little bit. But most of the time, if you're eager or keen to be on a particular elective, like you'll get there. And often, you gotta push the envelope a little bit and talk with other students. And there may be other names that aren't on this list that would be keen to accept a student. So there's some work that needs to be done by students to do that. And from a first year perspective, it seems like a lot, but you kind of get used to it. I do want to say, though, like once you lock that in, every elective experience that first day has always been a little awkward. Like there's a new personality and a new person that you got to get to know, and a new specialty. It's like a Pandora's box, like every 6 months,
Especially during COVID, Matt, maybe you don't always find people at their best because, like, let's face it, we're not all at our best right now.
No, absolutely.
It's like they used to be really nice. Now they just look frazzled and stressed out all the time. No, I'm joking, but
each elective has taught me so much, and I think most students walk away and go like, "Wow, that was insightful." And I think whatever you're picking, you don't really know what you're going to experience, what you're going to think and feel until you get through with it. And I think here at the St. John Regional Hospital, we're extremely blessed to have people who are willing to take us on, show us the ropes. And even despite a pandemic, like I can confidently say a lot of students have had extremely rewarding experiences is how I'd describe it. But it's intimidating at the start to figure things out. But once you kind of get that confirmation and you make them, submit that 145 form and you see your check mark, like it's all green lights. And I think every student here at DMB has a blast once that happens.
Oh, that's so good. Do you have any experiences, either of you, where like you did a project or something on elective? Because I think outside of just the joy of having the company of a student and enjoying their company and teaching, and especially we're still kind of talking about those early days electives where you're not necessarily going in to see the patient or like doing a lot of that kind of business. alone anyways, but you're coming in maybe with us, or maybe you're going and doing a little bit of the history sort of stuff or whatever you sort of in your scope at that time. Do you find that there's something special that any of your experiences offered that people could take away? Like you did a little project while you were with them, or you kind of did something outside of the box, like went to an administrative meeting, or I took a student to court once, for example, which arguably was traumatizing, but I didn't take them to court. They came to court with me. Any experiences like that?
I can't say I've ever been to court with any of the attending physicians I've worked with.
You can come with me next time if you want. It happens a lot.
Yeah, definitely.
Pediatricians go to court a lot. I feel like I should clarify that. Pediatricians go to court a lot because we go to family court a lot, not because we're sued a lot. Yeah. It's pretty low gear specialty. It's hard to do too much harm. We just really talk to people. Anyway, okay, sorry. Back to that, Mitch. Yes. So any experiences?
Yeah, definitely. So at Dow, for all elective experiences, students are required to do some sort of project or some sort of journal or anything in that regard to get accredited for that block. Mm-hmm. Myself, I didn't do anything overly ambitious, but I know there have been several students who have done really interesting things. So for example, one of my classmates did a project where they developed a brochure for patients who were having carpal tunnel surgeries done. So it really was something that they felt that they made a nice difference to the patient experience, because as a result of this pamphlet, the attending was able to give them this and talk through those different procedure steps and that sort of thing to make patients feel a little bit more comfortable. And some students do research projects as well. It really depends on the attending physician if that's something that they're interested in. But really sitting down with them at the beginning of your rotation and getting an idea as to what sort of projects may be available, or if there's anybody who does research, is a great way of coming up with something that can be mutually beneficial both for the attending and the student and even patients sometimes as well.
Because I think we all have that laundry list of like, oh, I wish I had a handout for this, but like we just don't have time to create it. And like, honestly, we could probably do it in our sleep if we just had the bandwidth to do it. And so, but it's also a learning experience for a student. What are the after OR considerations of carpal tunnel? And you guys are so much better at like making the graphics of things and stuff. You know how to do that. So it's so helpful. But then I think too, like, would you guys welcome experiences that people could offer you? Because I think it's hard for people to say, I'm going to take you every day or like every Monday afternoon, because weeks are so different. So like one example is we have this exercise, particularly myself and like Dr. McKenna and some of the other pediatricians enjoy this, where we you have a budget and you have to go to the grocery store and you have to take the bus to get there, and you have to like try to get groceries for the next week on a certain amount of budget, and you have 4 kids and these are the things you have to get, like diapers and da-da. And it's not meant to be patronizing. It's meant to just illustrate the point of how most of us go to the grocery store and we don't really look at the price tags of things because we're just like, I don't know, man, I need English cucumber because that's what I like. But, just trying to, drive home the point about how challenging it is, and then sort of picture yourself taking the bus back with all those groceries and arguably a couple kids in tow maybe and stuff. So there's these sort of experiences too that sound like a lot of work, but you just sort of dream them up. And then, so if that Monday, because I went on vacation, you had nothing to do, I either, pawn you off to somebody else to have an experience, or say, hey, why don't you just try this experience this week on your own time? What do you think of those kind of things?
I think that's a great idea. And I've experienced that too, especially the pawning off thing. And that's actually from a student perspective, that's super nice in the sense that, even within a specialty, there's subspecialties and everyone kind of has maybe like their niches or what have you. And And so like being pawned off, I keep using this word, but like being sent to go with someone for another day, I feel like from a student experience is always super insightful because you get to maybe see a slightly different scope of practice, but you also get to see the same practice just in a different lens because often physicians do things slightly different.
Oh, so you don't mind when we do that?
Oh, no. I mean, if it was like...
We feel guilty. We feel guilty.
No,
I do. I don't know. Maybe everybody else is rolling their eyes at me, but...
I think if it was every week, a student eventually would be like, I haven't done a day with my preceptor that accepted me, but like, I think in general, like it definitely offers like a more complete experience as well. And I think for a student, like most students, like their perspective is like, I'd like to check out this specialty. Your name was on the list, but like, if there's a way that I can get more out of my 4 hours today, they'll take that road, and it's nothing against that particular preceptor. It's just, okay, if you're telling me you're not busy this week, but you can create something that will help me get more out of it. Like from a student, like we're just yearning for every clinical interaction because they're relatively infrequent in the pre-clerkship kind of stage of our training.
Awesome. Well, let's talk about the third and fourth year stuff, Mitch, because like a bit of the history of the portal, I guess, is back in the day, you used to just sort of like secret squirrel try to get your electives. So like in my day, so let's see, it would have been 17 years ago. I would have been no, that's residency. Wait a minute. It's longer than that. Maybe 19 years, 20 years. It's almost 20 years. So like looking for electives, everybody knew the hard ones to get. So like peds neurology and IWK was impossible. And so like you basically had to sell your firstborn or know somebody there. Cardiology in Calgary, ICU in Ottawa. Like you knew the ones that were just like, you were winning the lottery if you got them. And then, you found the other ones as you went along. And you really kind of had to ask like it was a big old favor. Like all of these things are not a big old favor because that faculty get paid to have elective students, hey? But anyways, so the portal was meant to create this system whereby it seemed somewhat fair, like you put in a rank list almost of electives that you wanted. I think all of us have heard stories that were really frustrating when people would like put like derm plastics and they like wouldn't get any of them. And you're just like, seriously? And then there would be like backdoor things happen. But this has been such a different experience for you because it's all been, you said homeschool electives.
You got it.
So they gave up the portal for you guys to do that. And then it was sort of back to this phone a friend kind of situation.
Yeah, exactly. So they had two slightly separate systems for New Brunswick electives and then Dalhousie, Halifax electives as well. So the portal was no longer in use, and the general premise was that at 11 p.m. on whatever day, you were able to start emailing departments and booking electives, and it was a free-for-all. You could send as many emails as you want. Yeah, whatever
PM?
time it was a weird time.
That was a weird time.
I think it was 10 p.m., but yeah, it was very strange.
Okay.
Yeah, so everybody
had
had
Pearl Jam tickets, it's like set your alarm. I'm just going to like press the button. We won't answer anybody who emails at 9:59. Anyway, okay. Sorry,
exactly, yeah. Everybody had preset emails ready to go.
Yeah.
And just clicked the button at 10 p.m.
Wow.
So really, they created a system that for Halifax, it was more of a department-specific method. So you would send an email to the admin. You'd have a list of all of the departments at the beginning, and you would just email them the dates that you would like, if possible, and any flexibility that you may have in those dates, and they would accommodate you as best they could. I think it worked out really well for that. It was certainly a little stressful at the beginning, trying to send out as many emails as possible, not doubling up on any time slots and things like that. But you were able to get a response relatively quickly, given that it was department specific. So there were lots of people responding to emails all at once. In St. John, we had, or in New Brunswick as a whole, there was one central email that you would send it to, and you would submit 3 requests, your first, second, and third choice, and they would attempt to place you in your first choice, and then your second choice, and then your third choice. And they had that at 3 different intervals throughout the year, I believe. So that created a bit more of a fair process in terms of ensuring that students were able to to select one or two at a time and not kind of hoard all of the electives in one specialty. But certainly both had their pros and cons. Overall, though, I think the elective experience for us and the year prior to us at home schools were excellent. You don't get that sort of experience of seeing the programs as a whole for outside schools and determining where you want to live for the next 2 to 5 years, which can be a bit challenging. But being able to even travel within the Maritimes and talk to attending physicians who have trained in these different places and were able to do visiting electives really gave you a lot of insight in terms of what cities were really high on their list and why, and being able to do that really helped mitigate a lot of those challenges that we had as a result of it.
Because you didn't even really get to see those places in your interviews, right? Because everything was online.
Everything was online for interviews as well. Crazy. Although I think the online interviews were excellent. You could sit in your pajamas until about 10 minutes before the interview starts, put your suit on and just log in. It was
suit,
great.
Shirt and tie, right? You still had your pajama pants, right? Like still.
Yeah, I went for the full suit. I opted to wear everything. Like vision.
What if I stand up? What if the MMI makes me stand up? And I've got Spider-Man pajama pants on or something.
Exactly. I recall one classmate told me that the programs aren't allowed to ask you what you're wearing, but they could ask you something to the effect of, if you were to stand up right now, would that be a problem?
Oh my God.
Unfortunately, they had opted to wear pants, so.
Oh my God. That's funny. The other thing when you were talking, I was thinking, oh my God, if everybody sends an email at the same time, like the way my email comes, I like to read it in correct order.
Top down.
Yeah, like I like to read it as it comes. But like sometimes I find myself like, if something grabs your attention at the bottom, you end up going backwards. So if you go backwards, you might get somebody who emailed you at midnight instead of the person who emailed you at 10, and then it's not really first come, first serve. Anyways, those are the weird things I think about. But what about too, because I know like last year with CERMS, like NOSM, the Northern Ontario School of Medicine, had 2 unmatched ped spots. And that is kind of mind-blowing because we usually almost always match most, if not all, of the ped spots. And that is like an outstanding, excellent program. And like, if it had existed when I went, I would have been very interested in it because, especially with all of our Indigenous health considerations now and how committed many of us are with that. And I can only think that it had mostly to do with the fact that people hadn't gone there, so they didn't realize how awesome it was. They just were like, that seems far away. Not knowing what an excellent experience and how at home that group would make you feel. Do you find that people are making more choices that way, more about like, well, I've never been there, so I don't know, I guess I'll rank it low.
Yeah, it's so hard to rank programs that you've never been to. It all comes down to what you've heard from other people and the experiences they've really had. I know there's been certain programs that I've looked at and I thought to myself, can I see myself living there? And I don't know because you've never been there, right? And it's unfortunate because a lot of these programs that may be in these sort of obscure places that you may not have been to have excellent programs that you may thrive at. But if you don't really give it a chance, then they never get that opportunity to do that.
I just had another aha moment. What if when we're doing electives as faculty for you guys, because like I call my friend, like I know a lot of pediatricians in the country. It's not that big of a group. Like it'd be cool to almost call them and like introduce you to people. You know what I mean? Like maybe that's something that we could offer. Like, hey, my great friend Amy Acker, who's a pediatrician at Queen's, let's get her on the phone and do a case review one day. And like, she can talk to you about what would happen there. And like, you can kind of make it a fun learning experience. We love it because we get to talk to our friend. You could justify it because it seems worky. And then you guys will get sort of a glimmer into another site. Matt, you should suggest that on your electives.
That actually sounds like an awesome opportunity and idea, and especially in a virtual world, like any interaction, having like a face to connect with would actually be super huge.
Right. So what's going to happen, Matt, now that you guys are going into it and that the world's opening up, short of all of us getting COVID and then having to recover again, which is where I'm at?
Yeah, so I think from what I've been told so far is that the decisions for the class of 2023 is similar to what Mitch experienced this year. And so that electives will be here at home and traveling electives are still on the back burner. And I haven't heard any differences. And Mitch, feel free to jump in and correct me if I'm wrong. But the conversations for my class, so this would be in 2024, are still ongoing, and they're trying to see like what's feasible. I think there's a lot of rumors going around of interviews will be virtual forever. Will in-person electives come back? There's yeses, there's nos, and there's some saying there'll be like restrictions. So before maybe you could do all of your electives away or the majority of them, and now it would be capped to a certain amount of weeks. So I think there's discussions being had of what that looks like in like this, middle of the, we're not at the start of the COVID, or seem to be getting towards like the tail end of it, but we're not out of it as well. And so trying to find like, okay, what will be the normal then and stuff, but we really haven't heard. And as students, we're just like, especially the Uber planners in our class, like everyone's very keen. Are there a few of those in
your class, Matt?
Oh, there's a few, and
there's a few in every class, my friend.
Yeah, I'm usually one of the ones leading the charge on the planning. So, like you're trying to figure that out, but at the end of the day, like the ball's not in our hand, and you gotta wait to see. But I think most students are really hopeful that some traveling, maybe not all, but some traveling would be allowed, because it really would help the differential. And I would understand that from the perspective of the departments selecting their students, having them come in and being able to work alongside them would be just as beneficial for them as it would be for the student to experience it.
Yeah, you like to meet people too if you think that they're going to apply to your residency program, and it's so much more than the interview. Like you get so much out of that. I think the interview process, though, especially Mitch, like I've only heard positive experiences from the virtual interviews, and considering the boatload of money it costs to fly all over the country in Canada in February, I didn't even go to my Saskatoon interview because it would have cost an extra $1,600 and was in the middle of a snowstorm. And I thought, like, I can't, it's just because it was out of sync and snowstorms and stuff. And you just think, and still to this day, and I have so many friends in Saskatoon, I'm just like, oh, that would have been a lovely program to check out. But, so I think, yeah, but at the same time, you want to see some of these places. So I think that there's a couple of things, like you guys gave some great examples about how things were positive, where there was a few challenges that you overcame. I have a few sort of parting words for faculty about how they can get more out of electives, but what would you guys like to say sort of as your parting words for why faculty should just, when elective students come knocking, just say, bring it on?
Yeah, so I think overall elective experiences are great for both the student as well as the attending. And I think that the perception may be that students may be a bit of an anchor to your practice at the beginning of the day, but we quickly develop from an anchor to being a helpful hand.
Like a volunteer, you mean? Like an anchor, like they slow you down?
Like exactly, yeah. We quickly change to somebody who's helpful and can hopefully speed up the process for attendings at the end of the day. And it is a great learning experience that students really appreciate. And yeah, I think that it makes everybody's day brighter at the end of the day.
Good one. Matt?
Yeah, I think when you take on, especially a pre-clerk, when you choose to take them on, I don't think there's any question of it takes some time and maybe some effort at the beginning to nurture things and to establish a relationship and stuff. But as Mitch said, students are incredibly keen to have rewarding and effective and efficient electives. And I think by starting the experience head on and setting deliverables, setting expectations, teaching as you go with the hopes of that they can pick it up and maybe try carrying it as well. And I'm not talking leading the surgery, but the small things that can either help the staff, anyone within, the environment and the patient care kind of delivery. And giving us just a little bit of time, you'll see that much return on your investment. And I think in my experiences and from what I've heard people is the more you invest in a student, the more you'll get out of them and the more that you'll be able to enjoy the experience. And, I would think that any physician at the end of the day, like being able to pass on a few nuggets of information to someone who's kind of coming up through the ranks and, you can kind of show them the way a little bit. To them, it would mean a lot. And to you, I think it would be very, a rewarding kind of sensation and emotion as well. So it's nothing but positives.
Well, not to pull a Brene Brown, but she says that clear is kind. And I think it kind of goes both ways. I remember struggling at times with elective students because you almost think to yourself, oh, I really kind of wanted to go for a walk at lunchtime. And like, I don't want to chit chat. I want to get my notes done or like this sort of thing. And I think actually just saying that out loud to students is fine, even ahead of time, like, hey, Matt, you're going to be in my clinic. If it's nice, I go for a walk at lunchtime. You're welcome to join me. And so then I still get my walk or we grab a coffee or it's like, I really want to get my notes done today because I promised myself that I would before I go away next week. And like, as if you guys don't have something you can do on, to fuss away with too. And so just being clear so everybody kind of reaches their goals at the end of the day, but that students could say, you know what, we just did, the neuro exam and clinical skills. Maybe that's a bad example. The cardiology exam and clinical skills. And I'd really love to try that on our patient today since they're coming for a murmur. Or like, I definitely know how to do a history now. Like we're done learning how to do histories. So can I do the history and I can type it up for you afterwards. So then that documentation is done. And so then, and you can tell me what you think about my history. And so then, speaking up like that, I think is a good way of sort of being engaged too. And then it is such a positive experience. I think like the parting word for me is how many innovative ways that we can actually have elective students without it just feeling like Mitch's word, the anchor, but like, people say the duckling too, right? Like it only takes a student to follow you in the bathroom once to be like, okay, too close. But if you, just think about different ways and say like, hey, here's a chart for tomorrow's clinic, or my secretary is going to put out the charts for clinic. Why don't you read those? And then think of some extra questions you want to ask. Or I gave the example of the grocery store, or like, calling a friend in another town and being like, you should really check out Queens for a research or for a residency program. I think we can all think of some cool ways to make it a positive experience for everyone. Okay, you guys, well, I'm convinced. I'm due to tell them that I'm going to take some elective students for the fall. So, and I really, really appreciate your time today. I know sometimes as a student, it feels a titch vulnerable to talk about your experiences. So I'm so glad they were positive. And I wish you both the best of luck. Mitch, I know the countdown is on. Rank lists go in this week, I think. Right? Okay, so
they do, yes.
Best of luck to you both. And Matt, I'll probably see you in clerkship or beyond. So thanks you guys very much, and best wishes, of course.
Thank you so much, Dr.
Thanks for having us.
Thank you for listening to the Fac Dev Lounge podcast. Please leave us a review on iTunes, YouTube, or SoundCloud, and even a comment on some ideas for future podcasts. Thank you very much and have a great day.